Many everyday habits can subtly damage the eyes and lead to long-term vision problems. Frequent eye rubbing can weaken the cornea and contribute to keratoconus, while poor contact lens hygiene increases the risk of serious infections. Heavy screen use contributes to digital eye strain and a 21% increased risk of myopia for each additional hour spent on screens per day. Using expired makeup or failing to protect the eyes from ultraviolet rays can also lead or cause infections, irritation, and early cataract formation. These harmful practices, though common, have lasting effects on vision if not corrected. Additionally, prolonged exposure to dry environments, skipping regular eye exams, and not blinking enough during screen time further strain the eyes and worsen existing conditions. Many people also underestimate the importance of proper nutrition, even though vitamins like A, C, and E play a crucial role in maintaining clear, healthy vision. Incorporating these protective habits into daily life can significantly reduce the risk of long-term eye damage and support overall eye health. On today's episode of The Physicians, we'll be discussing common harmful eye practices and their effects on vision with our experts. Stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
It's another day with The Physicians, where your health is our business. My name is Dr. Martina Agbere, a regular anchor on this program, and with me, as usual, is my co-anchor.
My name is Dr. Imuna Yusuf Kadri. Welcome to The Physicians, where your health is our business.
And will always be our business.
Yes.
So we'll be discussing common harmful eye practices and their effects on vision. Dr. May, what comes to mind when you hear about common harmful eye practices?
The one that, if something enters your eye, you should use the urine to clean it, especially like early morning urine, which is very concentrated, which has...
who thought of such a thing? How?
Somebody, it has to start with somebody, and then it becomes a movement.
There's even the one that you use a mother as the first milk. They say is a
which
bad
is very
milk.
important.
The very important milk. They now use to cleanse the eye so that the baby can see well. And so we use this eye pencil.
Yes, the tiro. They call it tiro. They say to drive evil spirits away. Are you sure they didn't use it? Because your eye look like somebody that they use tiro for.
No, I won't use it. My parents will not even go that way because they're learning.
I hated that thing as a child, like literally, because when I see them put it, I'm like, this one wants to come and cut, because the way your eye will not be, yeah.
Innocent children, right?
Very
well, we'll be back
innocent.
after this short break. Just stay tuned. With me in the studio is no other person than our very intelligent Dr. Funmi Ekorowiro. He is a senior medical officer with the General Hospital IBEJU-LEKKI. You're welcome to our program.
Thank you.
You're
Common
welcome.
harmful eye practices. Wow. Well, let me first ask you, as a physician, and you see these patients regularly, why did you decide that it is actually now time for us to discuss these things? Because you must have been seeing a lot of things happening, right?
Yeah.
Put us in the loop. What did you see? What is it that comes to mind first when you talk about it?
Thank you for the opportunity to be here today again. One of the reasons why I actually chose the topic is because every week, at least I see a minimum of 10 to 15 patients that might have done something harmful to their eyes before coming to the hospital.
Every week.
Every
Wow.
week.
And that's just one center. We're not talking about over 200 centers in Lagos alone. One center having to see not less than 10 to 15 new cases, you mean, right?
New cases.
So of those new cases that you see, is it the same thing that the people come with, or different cases specific to them?
Though they often come with different cases, but they apply almost same thing to their eyes.
That's that's exactly where I'm going to. The same thing. Okay, tell us, what exactly is it?
So first of all, when they present to the hospital, they present late, because they would have done their own home remedy before coming to the hospital.
Okay.
And some of the things they actually apply on their eyes, like we said, the urine.
In 2020.
In fact, apart from that, they apply breast milk. They also apply herbs. They would have grinded the leaves, extracted.
Eyes that are so important like this.
These things you are talking about now,
It's not like a movie.
Are they applying it to the eyes of children or adults also coming with it?
Both children and adults.
Adults,
Yes. Grown adults.
we put herbs.
Yes, herbs. Not those three alone. They apply kerosene,
No,
lime
juice.
lime juice. They will extract the juice inside and apply it. To the extent of applying what is called battery water inside the eyes.
No, just
Take a deep breath. No,
just hold it there. They apply these things. What
Wow.
reason do they give? For
When they
applying-
come,
when
yeah.
they come, that this was the reason why I had to do this. What did they see? What was a health challenge that made them go using battery water?
So anytime I ask them those questions, the reason they do give to me, okay, they have been advised by their friends, families, neighbors who are thinking they are helping them.
So I think those friends need to be arrested. Yes, because
They are enablers.
they are really enablers, because if they haven't used it before, so why recommend?
Why recommend?
But if they've used it, they'll go through the challenge.
But is that not ignorance? Because the truth is that these things are, just hearing battery water, I almost jumped up from my seat. Like, these are acidic, you know, and then direct juice extra, like lime or lemon.
Yes.
That if when you put it in your mouth, you'll be, who did you offend? God, or witches or village people are after me. The way to slap the evil spirit out of you, then direct to the
Directly
eye.
inside
Then
the eyes.
what is it? That's terrible.
Okay, please continue. What other harmful habits have you seen?
Apart from that, they also go to as far as seawater that contains salt and other elements. They apply it inside the eye, and they present so late to the extent that you might not be able to even salvage the eyes again.
So these are like 100% preventable damages or causes to the eyes, because seawater, battery water, which direct juice water, whatever it is, you have absolutely no business with the eye. I know one of our renowned ophthalmologists that was here the other day, she said eye health is the real health. Yes. That if you talk about the 5 sensory modalities and ask people to choose which one, most people will choose to see. Then you are seeing, not that you are born blind, then you now put see what is salt and all. Those are terrible practices.
For just because of ignorance.
Ignorance, yes.
That's horrible. Really
no,
horrible.
it's not only ignorance. You are seeing them. Aside ignorance, what could be the reason?
I also believe that some of them is their belief, their cultural belief, and some are not aware.
Okay.
That's the reason why I'm here today, to actually enlighten them, to actually stop this harmful eye practice. And apart from that, I also think that they are not, they are being misinformed.
Okay. Well, that's why we have the physicians.
Yes.
Does poverty have anything to do with this?
I won't actually say poverty has anything to do with it, because you that can afford to actually go to the extent of using breast milk,
battery
water, you would have spent some money to actually go to purchase that battery water from those that are actually selling it. So you can actually come to the hospital with that. And also, I might say, okay, maybe the cost of hospital, they are going to pay in the hospital might contribute to it. But if they had come we will know what to do and how to actually help them. That is why we have social service, welfare service in the hospital. So I don't want to believe that it is poverty.
So you've talked about some of these harmful practices, what the things that they put in the eyes, right? That is direct, either urine, breast milk, seawater, acid, battery water, and all those stuff. Those are the things that you inject directly. How about the things that you don't inject directly, like the screen time?
Okay, about that screen time, it is an habit that has now become so common over time, even amongst the children.
Worse.
Very, very worse. Because increased time on the screen can cause dry eye, like I explained earlier on. The child will start straining. The child will start complaining of, mommy, I can't see when I'm in school. I can't see when I'm gazing on the TV, and all this they cause eye strain on the eyes, thereby affecting the vision of the child. It's just the child and we start squinting.
Yeah.
So that's an effect of it on the eyes.
So I think we need to break it down here, because parents are, these days, I'm busy, I have work to do, the child is crying and all that. Can you just help enlighten our audience? At what age should parents give screen, get a child to even look at the screen, and when should they not even bother at all?
The advice I would give to parents concerning screen time for children, any child less than 5 years should not actually be on the screen, because it's going to damage their eyes. From 5 years, they will soon start school.
Okay.
Fine, they will have started the preschool, but by then they will start writing, trying to figure out their skills. So at that time, they'll start complaining of squinting, blurry vision. They can't even see what you are even putting on the table for them to read. So that one is a lot for us. So I will advise mothers and even fathers not to allow their children to be on the screen when they are less than 5 years. And they should try and limit it to 30 minutes in a day is enough for a child.
So this screen time thing, right? I see it as a thing of that is more common with the elites. I may be wrong, because most of them are able to give tablets to their children.
Yeah.
Talking about screen time is not necessarily just being watching television.
Yeah, it's that tablet and not those children's toys.
Then mothers that just want to, that don't have that love, I want to say it, love for their children, because they want to give the tablet to the children so they can occupy themselves with other things.
They will say they are working or they are busy.
So which one is better? The other thing that the child can play with.
A lot
of toys. Allow the child to even be running about. That one is good. But just giving screen time. You think you are doing good. You put on cartoon, the child will watch and play and everything. But it's not really serving the purpose. Yeah. So I think that mothers and parents rather need to actually do more. Because if you know what is happening now, even when the parents are not home, the support staff.
Of course, support staff will just say, you stop crying or you leave. And because as a psychiatrist, we are gradually seeing cases now where it's affecting their emotional health. You just see the child throwing tantrum, getting angry easily, because it's withdrawal symptoms. Because now you're trying to take that screen from the child. The child is scattering and breaking things, and you are wondering if somebody is doing your child. You started it, and then the child got not only dependent or tolerant to it, but now addiction is setting in at such a very young age.
So Dr. Funmi, thank you for bringing all these to our notice. What you see on ground. It is not what hearsay, it is what you see. So for us to continue, do you just want to run through those things again so that those that are just joining us will hear? Those things that you listed that you see every week.
Okay. Like I said earlier on, most of the things that our patients apply into their eyes before presenting to the hospital, we have the breast milk, urine, herbs, lemon juice, then kerosene, battery water, sea water, and lots more.
I can imagine. These are like 7 things that I've just, grabbed now. And I think it's not just us, this information here, and to the physician, is for us to just keep like evangelists, ensuring that letting people know how bad it is. Don't use, if somebody say go and do this, no, see the doctor first before you go and put something in your eyes that will damage the eye, you know, completely. But aside this, why is it a harmful practice for people to use hand to rub their eye, especially for a long period of time?
Thank you for that question. Even when the patient comes to the hospital and they are trying to explain things to you, they are rubbing their eyes. So it's now like a common practice for everybody. Sometimes I say, okay, it's a reflex. Something is itching, you need to actually rub it. But you can actually try as much as possible not to also rub it. Because by the time you continue to rub it, it's going to cause what we call ulceration on the cornea. And by then, it is either the person is able to partially see or not see again.
Wow.
Because of that ulceration on the cornea.
Wow. Okay, you're talking now. You are taking us to the possible things that can happen.
Yeah.
Just from rubbing
eyes.
Okay, now talk of when you apply those chemicals to the eyes. So this takes us to complications. What are the possible things that can happen when you put those harmful substances in the eyes?
Okay, let me start with urine.
Okay.
Exactly.
Some of the complications that can happen, for example, there's a patient I saw that has gonorrhea.
Gonorrhea?
Yes.
Okay.
It didn't present with the symptoms early. It was when we did the culture for the eye swab that we now detected, okay, this guy had this gonorrhea. So he had already applied the urine on his eyes, and the cornea has already melted.
He didn't know that he had gonorrhea.
No, gonorrhea most times is symptomatic now.
So he didn't know.
It's
so when the cornea was, when I saw the cornea has already melted, I said, what happened? So it was not explaining what he has done. Not even, he didn't only apply urine, he applied breast milk as well.
And this is an adult.
He's an adult.
No, did he tell you the reason why he had to apply? What challenge, what problem was he having
initially? Yes.
Okay, he was having redness, pain, gritty sensation on the eyes. Okay. Before he was advised to apply urine
by the internet doctors.
No, internet.
By friends and family.
They are Google doctors.
They are not Google doctors. They are enemies and frenemies, and these are the real village people. Because truly, advising somebody to use urine that is a waste product. We know what the things are inside urine.
But there are certain things you even tell somebody, I say like seriously.
Exactly. That's why I said it's like witchcraft, like a cult. Because it sounds very strange.
And as well, let's go to the herbs. Herbs, they are not sterile. So when they come to the hospital, to the extent that they have to grind the leaves, extract the liquid inside, and package inside the eye drop dispenser. They go through that length. They go through that length. When they bring it to the hospital, I would just be like, well packaged and designed. I was just like,
waiting for NAFDAC certification.
And they apply it in such a way that, the way we say QDS, they apply it like that inside the eyes.
Oh,
They're so meticulous with it.
Oh no.
So by the time they come, there will be infection, there will be redness, there will be discharge, they cannot see. So they expect us to perform the magic for them to actually
obviously. And it will have just be easy to even put normal water.
If they are
you can't go wrong with using normal water.
Yeah, they say water no get enemy. But now you have gone to extract, but are there certain kind of leaves or certain kind of herbs that are more common that you are noticing in your practice? Because you know, we have just said generally herbs, right? Are there certain ones they call the most? Okay,
the ones I'm aware that they've actually used: scent leaf, bitter leaf. So those are the two leaves I know they actually grind together, extract the liquid, and apply on their
So you know what? Scent leaf, now that she's mentioned this, I know growing up, right, in our community, when you have an injury, they'll ask you to go and get scent leaf and put. So maybe that is the same reason why they are putting it.
That one is with the roughness and everything. They'll put it to stop the bleeding and heal. This one, they are extracting the juice. I don't see the process. They are waiting for NAFDAC certification.
Maybe that is the reason why they are putting it. If it works for the wound, it should be able to work for an ache. Pain too.
No.
Well, in fact, I'm just short of words. Since people they go to that extent of taking scent leaf, putting it in a little container like
apply 4 times a day,
and
3
apply
times a
4
day.
times a day.
Exactly.
Then before coming, then they shouldn't. Why did they have to come to hospital?
Because they are
Because they
unable
want
to
to
see and
see
they want us to
properly.
perform the magic for them to actually see back.
Okay, so you've talked about scent leaf, the herbs. You've talked about the acid water. Of course, there will be cornea, affect the cornea,
Yeah.
and every other thing. Then how about expired products, medication?
Okay, like we
That they
said,
also, yes.
yes, like we said, expired.
Okay.
It is not supposed to be administered into the eyes. When it's expired, you're expected to actually discard it.
And someone said it still has 3 months, even after,
grace,
whatever you are saying,
say it's 3
then
months grace.
That's 3 months grace.
What I do tell my patients is I can be unforgiving. Whatever you give to the eye will
take.
give it back to you.
In multiple folds.
In multiple folds. So when they say this is expired, especially for the eye is very, we are supposed to actually pamper our eyes.
Sure.
So when they say expired, you are not supposed to actually apply it to the eyes. What is good for the skin can damage the eyes.
Yeah, you are right. Yes, what's good for the skin can damage the eye.
That is
So what
true.
about the UV exposure? What will you say as an expert regarding ultraviolet exposure regarding the eyes?
Concerning ultraviolet exposure, for the children, like we said,
Yeah.
I believe mothers should bond more with their children.
Okay.
The act of bonding more, we actually reduce the time that they spend on the screen. And you can give them other things to actually do with their hands so that they can actually be familiar with it and also play with other children. Then apart from that, for the adults, because the light that is being emitted from the laptop, for those that deal with laptops and all those, I will advise them to actually go to the hospital, let them have their eyes screened. They can be prescribed lens,
Okay.
blue cut lens that can actually help them to shield away the light, the rays into the.
Because tech founders will start telling you what is this doctor saying now. This is where we are making our billions and how we become unicorn. So we must do the screen. We are front end web designers and all those other things. So that's blue.
The blue cut lens can
lens.
help them.
Okay,
Oh,
so
that's
maybe you
good to
should,
know.
before you leave, maybe you should just tell us in summary the importance of protecting the eyes and possible things that can happen if you do use the harmful substances.
Thank you. One of the importance of protecting our eyes is for us to be able to see. Because if we can't see, then I don't think we'll be able to carry out our activities. And then we'll be deprived of a lot of things. And some of the things we can do to prevent all this is early presentation to the hospital. Listening to advice from friends, relatives, fine, they might think they are doing us good, but it is misinformation. I will advise us to present to the hospital as soon as possible. And not just an hospital, to see an eye specialist who can help us to examine the eye and also provide necessary treatment for the eyes.
Wow. Thank you
Thank
so
you very much. You've actually done justice to this topic, and even bringing it to our knowledge, the kind of things that people use. I've heard so many, but not battery water.
Like
I can't really get over that. So thank you so much for being part of our program today. Just be rest assured that we will still come calling again, so that because you are on ground, you see them. This is evidence-based. So you are actually going to be telling us more of the things that you see in your clinic and how you're able to manage them. And to our viewers out there, I'm sure you've heard all that Doctor has said today, harmful practices that people actually can do to the extent of using battery water, using acid, urine, juice, seawater, herbs. Do you just love your eyes? You just love your eyes. It's good to love your eyes. All these things are very harmful and they will destroy you. And if it does destroy, what happens? Blindness. Most times irreversible. So please, let's try as much as possible to avoid these harmful practices. For parents, please, let's try and help our children. These devices that we give to them is not because you want more time for yourself. You want to give to the children. You're harming them. Please let us desist from them. On final notes, my name is Dr. Martina Agberian. Till next time, stay blessed.
Thank you so much, Dr. Funmi. And of course, to all our viewers out there, this is always our call to action. Do the needful. Your eyes are very important. Without them, there's just little you can do, right? But please ensure that you join us on this show on a regular basis. We air 7:30 p.m. every Saturday. Prime time, which is family time. So invite your family friends to watch The Physicians, where we help as much as possible bring topical issues like this to reduce misinformation and disinformation. Be kind to follow us on all our various social media platforms. And if you want to be a guest on this show, you know what to do. Go to our website, fill the form, and you are here to share your knowledge with the world. Until next time, my name is Dr. Emena Yusuf Kadri. Remain blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.